Okay, now I'm gonna test the multifidus muscle, which is an extensor of the back. So what I'll do is I'm gonna palpate around. Do you mind if I lift your shirt a little bit, just a little bit? I'm just gonna palpate around the spinous processes and the transverse processes around where the multifidae articulate. So what I'm gonna have you do is think about bringing your tailbone up to the ceiling, just slightly, kind of like that. Like try to bring your hips down a little bit. Now try to think, just bring your hip like back. Okay, now what I'm gonna do is I'm gonna test the multifida muscle assessment. The multifida are articulated to the transverse process of the back and they're a back extensor. So what I'm gonna do is palpate around the transverse processes. Can you think about you having a tail being pulled up to the ceiling? Okay, and then I'll look for any muscles firing there, and I don't seem to feel them right here. So that would indicate, what I'll do now is I'll test the firing of the transverse abdominis. Transverse abdominis is on the abdominal side. What I'll do is I'll palpate just medial to the ASIS, and I'm gonna ask the patient to think about bringing these 2 points together and kind of just like tightening your abs right there. I didn't feel the muscle fire right away, so I would assume that we have to do. What I'll be doing now is I'm going to be doing biomechanical correction and external stabilization of the lumbar spine. So what I'll do first is the biomechanical correction. For that, I'm going to find one segment of the spine that's more hypomobile, and I'm gonna palpate there. I'm gonna give superior force to that spinous process, and I'm just gonna come around and give counter force right around the stomach right here. So what I'm gonna do is hug and lift. Can you bend down for me? All right, you can come back. And how did that feel? Was it helpful?
Yes.
Okay, good. And what I'll do now is I'm gonna provide a external stabilization to lumbar spine. So for that, I'm just gonna put one hand on the lower abs and the other hand on the lumbar spine. I'm just gonna hug and lift, and I'm gonna ask you to go down again. Okay, and come back. Was that helpful?
Yes.
Yeah, it seemed like that. So what I'll have there is both worked. So I'll do both stabilization and mechanical correction breakouts later on. So what I'll do now is I'm going to assess the hypomobility of the person's spinal segments with a pivum and a pavum. So I'm just gonna have you come a little closer to me if you can. I'm just gonna slightly bend your knees and palpate around the lumbar spine area. So I'm palpating, I'm trying to find if there's any hypomobility or areas that are a little more closed than open in the spinous processes. Once I find that area, I'm just gonna do a little more flexion and see if that changes anything right there. And that's my pivum. Okay, now I'll be assessing the pavum. So I'm just gonna have you give your arm like right there. I'm just gonna be providing a little force here, determining if, hold on one sec. Okay, now I'm going to check for the 4-directional stress test of the lumbar spine. What I'll do first is I'm going to check for side bending stress. So I'll put my forearm just over the quadratus lumborum area. I'm going to see if applying a little force there hurts at all. Does it hurt? A little bit right there? Okay. Now what I'll do is I'm going to check for anterior stress. So I'm just going to apply some anterior force right here. Does that hurt at all?
Yes.
Yes. Okay. I'm just gonna kind of wrap my arm like under your arm and and I'm just gonna go like this. I'm taking it easier on her because she has a shoulder injury. Does that hurt at all?
A little.
A little bit? Okay. So now what I'll have you do is sit up. So what I'll do is you're just gonna have your arms up like this. I'm gonna give you a little hug, and what you're gonna do is try to push me away. Okay, so I'm feeling right here at the lumbar segments again. This should induce a little stress, so do you feel any pain right here?
Yes.
Okay. So any positive findings would be the patient's symptoms and presence of the instability. Okay, the technique I'll do now is positional release technique, specifically for the erector spinae muscle. We found that the multifidi kept firing when we were testing the muscle, so we want to make sure that the erector spinae is relaxed so it can properly fire. So what I'll do first is I'll have you roll towards me. We're going to focus specifically on the right erector spinae. Can you come a little closer? And I'm palpating for the erector spinae right here. I'll just have you kind of bent, go into lumbar flexion and straighten out that bottom leg. Yeah, just like that. Can I take your left hand and kind of rolling you like this and feeling the erector spinae for its most shortened position. All right. And once I know it's in its most shortened position, I'm just gonna hold it right here for 30 seconds to 90 seconds to 3 minutes, or until I feel the muscle relax. So once I ensure that the muscle has relaxed, I'm gonna do a little visualization technique. So Matt, I want you to think of your erector spinae muscle as butter, and I want you to think of my hands as a hot knife, and I want you to imagine that sinking into your muscle.
Okay.
So once I do that, I should feel the muscle relax, be smooth just like butter. And then after that, I'll reassess. All right, and another technique I'm going to do is erector spinae manual stretch. So I'm just gonna take my forearms and put them at either sides of the torso, and I'm just gonna stretch them out like this, and this will specifically deactivate the nervous system guarding the muscle. And just hold it there, and good. Palpate, and the muscle should feel more relaxed.